Hello everyone, I am Dr. Devjani Mukhopadhyay, Consultant Gynecologist and Gynecological Oncology Unit Lead at Barking, Havering and Redbridge University NHS Trust. My passion is to work on cancer prevention, and what best topic than cervical cancer, which is a preventable disease. On this occasion of Cervical Cancer Prevention Awareness Week, let's understand how we can prevent it by using the HPV vaccine. My previous video dealt with cervical smear test, the other way to prevent cervical cancer. I attach a link below of my previous video. Although it impacts women, men too have an important role to play. What is this HPV or human papillomavirus? It is a common virus and most of us may have experienced it on the lips after an illness. There are over 100 different types of HPV and about 15 are called high-risk HPV, meaning they have the potential to cause cancer. They reside in about 80% of the sexually active people and are responsible for nearly all of the cervical cancers. The thing to be wary about is that it does not cause any symptoms, so you will not know if you have it or not unless you get yourself checked for it. Important thing to remember is it spreads via sexual contact, even touching. How does HPV affect our body? Well, most people will get rid of them with good immunity, but some people are not able to do so. These viruses that continue to live in a body for some time can cause precancerous changes in the cells of that area, especially if you have the risk factors I have mentioned in my previous video. If these precancer cells go untreated, needless to say, they will progress to cancer. In women, it causes cervical, vulval, and vaginal cancers, and in men, it causes penile cancers. It causes anal and oropharyngeal cancers in both men and women. Apart from cancers, types 6 and 11 can also cause anogenital warts. Now, we discuss the vaccines against HPV. The bivalent vaccine is made by GlaxoSmithKline and is called Cervarix. It gives protection against the two most common high-risk virus types, 16 and 18. In India, HPV type 16 and 18 cause more than 80% of all cervical cancers. The quadrivalent vaccine is made by Merck & Co. and is called Gardasil. It gives protection against HPV type 16 and 18 and the two most common viruses causing anogenital warts, namely 6 and 11. It is important to understand that the vaccine prevents the virus from entering the body. It does not treat the virus that is already present in the body. As HPV affects both men and women, countries like USA and UK use it to vaccinate boys as well. Neither vaccine contained live virus. The latest addition among the HPV vaccines is Gardasil 9. This protects against HPV types 6, 11, 16, 18, 31, 33, 45, 52 and 58. We already know the harms caused by HPV type 6, 11, 16 and 18. Types 31, 33, 45, 52 and 58 are the ones that cause cervical cancer in the rest of the 15%. These types of HPV also cause most anal and some genital and head and neck cancers like mouth and lips, voice box or larynx, throat or pharynx, salivary glands, nose and sinuses, area at the back of the nose and mouth, or nasopharynx. Although the vaccines can be used from girls aged 9 years, the common practice is to vaccinate girls between 12 to 13 years, ideally before the exposure to sex. In India, under 15 years are given 2 doses, 6 to 12 months apart, and over 15 years and immunocompromised women are given 3 doses, 6 to 12 months apart. They can be taken till the age of 25 or even later up to the age of 45, albeit the effectiveness decreases with increasing age. It would be a logical question for parents to ask if the vaccine would harm their daughters. HPV vaccines are not new and have been available since 2006. Over 200 million doses of the vaccine have been administered globally, with close monitoring to study any adverse reactions. Careful consideration of safety and cost-benefit data have led to licensing the vaccine in over 100 countries across the globe, with 80 countries having introduced the vaccine in their national immunization programs. The proof of efficacy of the HPV vaccine has been obtained from these national vaccination programs in countries like Australia and USA, and there has not been any record of any serious side effect. The paper published in Lancet Oncology in 2016 show the results of a study from India that administered approximately 35,000 doses in girls aged between 10 to 18 years, with a 4-year follow-up reported no serious adverse events attributable to the HPV vaccine. WHO, UNICEF, Federation of Obstetric and Gynecological Societies of India or FOGSI, and the Indian Academy of Pediatrics have all strongly recommended the use of the HPV vaccine to protect against cervical cancer. The vaccine appears to be the most effective way to ensure the safety of our daughters in the future and make this disease extinct in a few decades to come. Even nearly 10 years of use, there is no evidence of waning vaccine effectiveness and no breakthrough cases, like precancerous cervical lesions caused by vaccine-type HPV in vaccinated women have been reported. Research is continuing to monitor the duration of protection and need for a booster dose. Current bivalent and quadrivalent vaccines do not protect against all oncogenic viruses, so even if fully vaccinated at the right age, cancer screening by cervical smear test and then colposcopy if needed should continue. If you wish to protect your daughters from cervical cancer, please contact a pediatrician for the HPV vaccine. I strongly believe together we will beat cervical cancer. Thank you for your time. If you liked my video, please like, share and subscribe and spread the word around. Let's just do it.